Hi, I'm Mark Johnson, your educator at YNS. Today's session covers a new set of NCLEX practice questions using our partner platform, Exam ASAP. This innovative AI-powered question bank adjusts to your performance and provides audio rationales for a unique and efficient review process. For full access, please refer to the description box below. Have your notebook ready and follow along as we sharpen your critical thinking skills. Let's get started with question 1.
A 30-year-old client in the emergency department is diagnosed with compartment syndrome following a traumatic leg injury. The client is in severe pain and is becoming increasingly agitated and fearful about potential loss of limb function. What is the nurse's priority intervention to address the client's psychosocial crisis? Administer prescribed analgesics to manage pain. Explain the surgical procedure to relieve pressure in the compartment. Reassure the client that the medical team is working to save the limb. Facilitate immediate surgical consultation to address the physical condition. The correct answer is C. Rationale. Correct answer, the third option. Reassuring the client that the medical team is working to save the limb is crucial in addressing the client's immediate psychosocial crisis. This intervention helps to alleviate fear and anxiety by providing emotional support and assurance of the team's commitment to the client's well-being. While pain management and surgical intervention are critical, addressing the client's emotional distress is a priority to prevent further agitation and facilitate cooperation with medical procedures. Distractor rationales. A. The first option. While pain management is important, it does not directly address the client's fear and anxiety about limb function. B. The second option. Explaining the procedure may not be effective if the client is too agitated to process information. D. The fourth option. Surgical consultation is necessary, but the immediate psychosocial need is reassurance and emotional support. Clinical tip. In crisis situations, addressing the client's emotional and psychological needs is as important as managing physical symptoms to ensure comprehensive care. A 5-year-old child has been diagnosed with recurrent otitis media and is experiencing significant hearing loss. The child's parents express feelings of guilt and anxiety about their child's condition and its impact on their development. As a nurse, what is the most appropriate intervention to support the parents' psychosocial needs? Here are the options. Option 1. Provide educational materials about otitis media and its management. Option 2. Encourage the parents to express their feelings and concerns about their child's condition. Option 3. Refer the family to a pediatric audiologist for further evaluation. Option 4. Suggest the parents join a support group for families dealing with hearing loss. The correct answer is B. Rationale. Correct answer, the second option. Encouraging the parents to express their feelings and concerns is crucial in addressing their psychosocial needs. This intervention provides emotional support and helps the parents process their emotions, reducing feelings of guilt and anxiety. Open communication allows the nurse to assess the parents' understanding and readiness to cope with the situation. It also builds trust and rapport, which are essential for effective family-centered care. Distractor rationales. A. The first option. While educational materials are helpful, they do not directly address the parents' emotional needs or provide an opportunity for them to express their feelings. C. The third option. Referring to a pediatric audiologist addresses the child's medical needs but does not support the parents' psychosocial concerns. D. The fourth option. Joining a support group can be beneficial, but it is not the immediate intervention to address the parents' current emotional state. Clinical tip. When working with families experiencing stress due to a child's health condition, prioritize interventions that facilitate open communication and emotional support to enhance coping and resilience. An 80-year-old client with normal pressure hydrocephalus is admitted to the hospital for evaluation. The client exhibits a shuffling gait, urinary incontinence, and mild cognitive impairment. The nurse is preparing the client's room to ensure safety. Which of the following interventions should the nurse implement first? Here are the options. Option 1. Place a bed alarm on the client's bed. Option 2. Ensure the call light is within reach. Option 3. Remove all loose rugs from the room. Option 4. Provide a bedside commode. The correct answer is C. Rationale. Correct answer, the third option. Removing all loose rugs from the room is the first intervention to ensure safety for a client with normal pressure hydrocephalus. The client's shuffling gait increases the risk of tripping and falling, making it crucial to eliminate potential tripping hazards. While other interventions like placing a bed alarm and ensuring the call light is within reach are important, they do not directly address the immediate risk of falls due to environmental hazards. Distractor rationales. A. The first option. While a bed alarm can alert staff to the client getting out of bed, it does not prevent falls caused by environmental hazards. B. The second option. Ensuring the call light is within reach is important for client communication, but does not directly address fall prevention. D. The fourth option. Providing a bedside commode is helpful for urinary incontinence, but does not address the immediate risk of tripping over loose rugs. Clinical tip. Always assess the environment for potential hazards, especially for clients with mobility issues. Removing tripping hazards is a key step in fall prevention. A 60-year-old client with scleroderma is being evaluated for new medication management. The client reports difficulty swallowing and frequent heartburn. The healthcare provider prescribes a proton pump inhibitor, PPI, to manage the gastrointestinal symptoms. Which instruction should the nurse prioritize when educating the client about this new medication? Here are the options. Option 1. Take the medication with meals to enhance absorption. Option 2. Take the medication on an empty stomach, 30 minutes before meals. Option 3. Crush the medication if swallowing is difficult. Option 4. Take the medication at bedtime for best results. The correct answer is B. Rationale. Correct answer, the second option. Proton pump inhibitors, PPIs, should be taken on an empty stomach, 30 minutes before meals, to maximize their effectiveness in reducing gastric acid production. This timing allows the medication to be absorbed and active when the stomach is stimulated to produce acid. Taking it with meals or at bedtime may reduce its efficacy. Crushing the medication is not recommended as it may alter the drug's release mechanism. Distractor rationales. A. The first option. Taking the medication with meals can decrease its effectiveness as PPIs work best when taken before meals. C. The third option. Crushing the medication can interfere with its intended release and absorption. D. The fourth option. Taking the medication at bedtime is not optimal for PPIs, which are most effective when taken before meals. Clinical tip. Educate clients on the importance of timing when taking PPIs to ensure optimal absorption and effectiveness in managing symptoms. A 28-year-old female client with a history of pelvic inflammatory disease, PID, is admitted to the hospital with severe abdominal pain and fever. Her vital signs are BP 110 70 millimeters of mercury, HR 102 BPM, RR 20 breaths per minute, and temperature 101.5 degrees Fahrenheit. The client is scheduled for an emergency laparoscopic surgery. As the nurse preparing the client for surgery, which action is the highest priority to ensure a safe and effective care environment? Here are the options. Option 1. Verify the client's informed consent for surgery. Option 2. Ensure the client has an intravenous line for antibiotic administration. Option 3. Check the client's allergy status and document it. Option 4. Educate the client about postoperative pain management. The correct answer is A. Rationale. Correct answer, the first option. Verifying the client's informed consent for surgery is the highest priority to ensure legal and ethical compliance. Informed consent is a legal requirement and ensures that the client understands the procedure, risks, and benefits. Without consent, proceeding with surgery would violate the client's legal rights and could result in legal consequences for the healthcare team. Distractor rationales. B. The second option. While ensuring an IV line for antibiotics is important for infection control, it is not the highest priority compared to obtaining informed consent. C. The third option. Checking and documenting allergies is crucial for safety, but it does not take precedence over obtaining informed consent. D. The fourth option. Educating the client about postoperative pain management is important for patient care, but is not the immediate priority before surgery. Clinical tip. Always verify informed consent before any surgical procedure to uphold the client's legal rights and ensure ethical practice. A 45-year-old client with a sedentary lifestyle presents to the clinic with lower back pain radiating to the left leg. The healthcare provider suspects a herniated disc. As part of health promotion and maintenance, which lifestyle modification should the nurse prioritize to prevent further complications? Here are the options. Option 1. Encourage regular physical activity tailored to the client's abilities. Option 2. Advise complete bed rest until the pain subsides. Option 3. Recommend a high-protein diet to support muscle repair. Option 4. Suggest using a lumbar support belt at all times. The correct answer is A. Rationale. Correct answer, the first option. Encouraging regular physical activity tailored to the client's abilities is crucial in managing a herniated disc and preventing further complications. Physical activity helps strengthen the muscles supporting the spine, improves flexibility, and reduces the risk of future injuries. It is important to tailor the activity to the client's current abilities to avoid exacerbating the condition. This approach aligns with health promotion by encouraging a lifestyle change that supports long-term musculoskeletal health. Distractor rationales. B. The second option. Complete bed rest is not recommended as it can lead to muscle atrophy and worsen the condition. C. The third option. While a balanced diet is important, a high-protein diet alone does not address the underlying issue of physical inactivity. D. The fourth option. A lumbar support belt may provide temporary relief but does not address the need for strengthening and flexibility. Clinical tip. For clients with herniated discs, emphasize the importance of core strengthening exercises and maintaining a healthy weight to reduce spinal stress. A patient in the emergency department presents with neutropenic fever and suspected septic shock 8 hours post-thoracotomy for lung cancer excision. The patient is on dopamine at 5 megagrams per kilogram per minute and has received broad-spectrum antibiotics. Lab results show declining WBC count and DIC. Hemodynamics indicate persistent hypotension despite fluids. Evaluate each intervention's appropriateness. Rationale. Correct answer. Detailed reasoning provided below. Distractor rationales. 1. Row 1. Administer IV hydrocortisone. Selected indicated because it can help manage septic shock refractory to fluid and vasopressor therapy, addressing potential relative adrenal insufficiency. Hydrocortisone is recommended for patients with septic shock who remain hypotensive despite adequate fluid resuscitation and vasopressor therapy. Merrick et al. 2022. Row 2. Increase dopamine to 10 micrograms per kilogram per minute. Selected. Contraindicated because increasing dopamine at this point could lead to excessive tachycardia and arrhythmias without significantly improving blood pressure, especially given persistent hypotension. Dopamine at higher doses can increase myocardial oxygen demand and risk of arrhythmias, making it less favorable compared to norepinephrine in septic shock. Dellinger et al., 2023. 3. Administer fresh frozen plasma. Selected indicated because DIC pattern suggests clotting factor replacement may be necessary to manage coagulopathy. Fresh frozen plasma can replenish clotting factors and is indicated in cases of DIC with bleeding or planned invasive procedures. Levy et al., 2023. 4. Start norepinephrine infusion. Selected indicated because norepinephrine is the first-line vasopressor for septic shock, unresponsive to fluid resuscitation, helping to maintain MAP greater than 65 millimeters of mercury. Norepinephrine is preferred due to its potent vasopressor effects and fewer cardiac side effects compared to dopamine. Rhodes et al., 2023. 5. It does not address the underlying causes of septic shock or improve hemodynamics in this scenario. Acetaminophen is primarily used for fever reduction and does not impact the hemodynamic stability of a patient in septic shock. Kumar et al., 2023. Clinical tip. In patients with septic shock, norepinephrine is preferred for its potent vasopressor effects and fewer cardiac side effects compared to increasing dopamine beyond moderate doses. A 72-year-old client with a history of chronic heart failure is admitted to the hospital with confusion and muscle weakness. Laboratory results reveal a serum sodium level of 125 milliequivalents per liter. The nurse is preparing to administer a hypertonic saline solution as prescribed. Which of the following actions is the most critical to ensure the client's safety during this treatment? Here are the options. Option 1. Monitor the client's blood pressure every 15 minutes. Option 2. Assess the client's neurological status hourly. Option 3. Restrict the client's fluid intake to 500 milliliters per day. Option 4. Place the client on seizure precautions. The correct answer is D. Rationale. Correct answer, the fourth option. Placing the client on seizure precautions is crucial because hyponatremia can lead to cerebral edema and increase the risk of seizures. Administering hypertonic saline can rapidly shift fluid into the intravascular space, potentially exacerbating neurological symptoms. Seizure precautions, such as padding the bed rails and having emergency equipment readily available, are essential to prevent injury and ensure the client's safety. Distractor rationales. A. The first option. While monitoring blood pressure is important, it is not the most critical action for preventing complications related to hyponatremia. B. The second option. Assessing neurological status is important, but seizure precautions directly address the risk of seizures. C. The third option. Fluid restriction is a common intervention for hyponatremia, but it does not directly address the immediate safety concern of seizures. Clinical tip. In cases of severe hyponatremia, always consider the risk of seizures and implement appropriate precautions to protect the client from injury. A 45-year-old male client with a history of alcoholic hepatitis is admitted to the hospital for worsening liver function. He expresses feelings of guilt and shame about his drinking habits and is worried about his family's future. The nurse observes that the client is withdrawn and avoids eye contact. Which nursing intervention is most appropriate to address the client's psychosocial needs? Here are the options. Option 1. Encourage the client to join a support group for individuals with liver disease. Option 2. Discuss the client's feelings and explore coping strategies with him. Option 3. Provide educational materials about liver disease and its management. Option 4. Refer the client to a dietitian for nutritional counseling. The correct answer is B. Rationale. Correct answer, the second option. Discussing the client's feelings and exploring coping strategies is the most appropriate intervention to address his psychosocial needs. This approach allows the client to express his emotions, which is crucial for mental health, especially when dealing with guilt and shame. It also helps the nurse to assess the client's coping mechanisms and provide support or suggest alternatives. This intervention aligns with the principles of therapeutic communication and psychosocial integrity. Distractor rationales. A. The first option. While joining a support group can be beneficial, it may not address the immediate emotional distress and is not the first step in this scenario. C. The third option. Providing educational materials is important for disease management, but does not directly address the client's emotional and psychosocial concerns. D. The fourth option. Nutritional counseling is important for managing liver disease, but does not address the client's current psychosocial distress. Clinical tip: when addressing psychosocial needs, prioritize interventions that facilitate open communication and emotional expression. This helps build trust and supports the client's mental health. A 75-year-old resident in a long-term care facility has a history of chronic kidney disease. He presents with confusion and a serum potassium level of 6.5 MEq per liter. What is the immediate nursing intervention? Here are the options. Option 1. Administer calcium gluconate. Option 2. Increase dietary potassium intake. Option 3. Prepare the resident for dialysis. Option 4. Monitor urine output closely. The correct answer is A. Rationale. Correct answer, the first option. Administer calcium gluconate. In cases of severe hyperkalemia, administering calcium gluconate helps stabilize the cardiac membrane and reduces the risk of life-threatening cardiac arrhythmias. Increasing dietary potassium intake, the second option, is contraindicated. Preparing for dialysis, the third option, is a longer-term solution and not immediate. Monitoring urine output, the fourth option, is important, but does not directly address hyperkalemia. Distractor rationales. B. The second option. This option is incorrect because increasing dietary potassium is contraindicated in hyperkalemia. C. The third option. This option is incorrect because while dialysis may be necessary, it is not immediate. D. The fourth option. This option is incorrect because although monitoring urine output is important, it does not address the acute problem. Clinical tip: in hyperkalemia, prioritize interventions that protect the heart from the effects of elevated potassium levels. A client with Alzheimer's, chronic kidney disease, and recent GI bleeding received a phenytoin loading dose 1 hour ago. Labs: HGB 8.2 grams per deciliter, platelets 150,000 millimeter cubed, albumin 2.8 grams per deciliter. Evaluate phenytoin effects by determining expected versus unexpected findings. Determine expected versus unexpected findings post-phenytoin. Rationale. Correct answers: 1. Confusion and agitation, expected. 2. Gingival hyperplasia, unexpected. 3. Hypotension and bradycardia, unexpected. 4. Nausea and vomiting, expected. 5. Nystagmus, expected. Step-by-step clinical reasoning. 1. Confusion and agitation are expected due to phenytoin CNS effects, exacerbated by Alzheimer's and low HGB, affecting cerebral perfusion. 2. Gingival hyperplasia is associated with chronic phenytoin use, not acute administration. 3. Hypotension and bradycardia are rare unless phenytoin is infused rapidly, which is not indicated here. 4. Nausea and vomiting are common acute side effects due to phenytoin's vestibular effects. 5. Nystagmus is an early sign of phenytoin toxicity. especially with low albumin increasing free drug levels. Pharmacology reference, 2023. Distractor rationales. 0. Confusion and agitation are expected due to phenytoin CNS effects, especially in Alzheimer's patients with low HGB affecting cognitive reserve. 1. Gingival hyperplasia is a chronic side effect of phenytoin, not expected immediately after a loading dose. Neurology Guidelines, 2023. 2. Hypotension and bradycardia are unexpected unless phenytoin is infused rapidly, which is not the case here. Cardiology Standards, 2023. 3. Nausea and vomiting are expected due to phenytoin's acute CNS effects, particularly in clients with GI comorbidities. Gastroenterology Guidelines, 2023. 4. Nystagmus is expected following a phenytoin loading dose, indicating therapeutic levels, especially with low albumin, increasing free drug availability. Pharmacology reference, 2023. Clinical tip. Clinical pearl. In Alzheimer's patients, phenytoin can exacerbate confusion. Monitor closely, especially with low albumin levels, increasing free drug concentration, enhancing CNS effects. A 35-year-old client is admitted to the psychiatric unit for evaluation of a suspected sleep disorder, experiencing chronic insomnia over the past 6 months. The client reports feeling anxious and irritable, with difficulty concentrating at work. Which nursing intervention should be prioritized to address the client's immediate needs related to their mental health? Here are the options. Option 1. Administer prescribed sleep medication immediately. Option 2. Encourage the client to establish a bedtime routine. Option 3. Initiate cognitive behavioral therapy for insomnia. Option 4. Instruct the client on relaxation techniques. The correct answer is D. Rationale. Correct answer, the fourth option. Instruct the client on relaxation techniques. Teaching relaxation techniques, such as deep breathing or guided imagery, offers immediate support for reducing anxiety, which is closely linked with sleep disturbances. This intervention helps to calm the client's mind, potentially improving sleep quality temporarily, while long-term strategies are developed. While cognitive behavioral therapy and establishing a routine are beneficial, they do not provide immediate relief for anxiety or sleep onset. Medication might be considered, but non-pharmacological methods are preferable initially to avoid dependency. Distractor rationales. A. The first option. Administering medication may be necessary, but is not the first line due to potential side effects and dependence. B. The second option. A bedtime routine is important, but does not address the immediate anxiety contributing to sleep issues. C. The third option. Cognitive behavioral therapy is effective long-term, but not a fast solution for immediate anxiety or sleep initiation. Clinical tip. Utilize relaxation techniques as a first-line strategy to help clients manage anxiety, especially when sleep disorders are present, as they can provide quick relief from stress and improve sleep readiness. A 32-year-old postpartum client is experiencing heavy vaginal bleeding 2 hours after delivery. The nurse notes that the client's perineal pad is saturated within 15 minutes. Which infection control measure is most critical to implement immediately in this situation? Here are the options. Option 1. Apply sterile gloves before assessing the perineum. Option 2. Ensure proper hand hygiene before and after contact. Option 3. Use a sterile drape to cover the perineal area. Option 4. Administer prophylactic antibiotics as prescribed. The correct answer is B. Rationale. Correct answer, the second option. Ensuring proper hand hygiene before and after contact is the most critical infection control measure in this scenario. It prevents the transmission of pathogens to the client, especially when managing postpartum hemorrhage where multiple interventions and assessments are required. Hand hygiene is a fundamental practice in maintaining a safe and effective care environment. Distractor rationales. A. The first option, while sterile gloves are important, hand hygiene is the foundational step in infection control. C. The third option, a sterile drape is not immediately necessary and does not replace the need for hand hygiene. D. The fourth option, prophylactic antibiotics may be prescribed, but immediate infection control focuses on hand hygiene. Clinical tip: always prioritize hand hygiene as the first step in infection control to protect both the client and healthcare provider from potential infections. A 6-month-old infant is admitted to the pediatric unit with bronchiolitis. The infant's mother, who is a single parent, appears visibly anxious and overwhelmed. She mentions that she has been unable to sleep or eat properly since the infant's symptoms began. The mother also expresses concern about missing work and the potential financial impact. As the nurse, what is the most appropriate initial intervention to support the mother's psychosocial needs? Here are the options. Option 1. Encourage the mother to take a walk outside to clear her mind. Option 2. Provide information about local support groups for single parents. Option 3. Offer to contact a social worker to discuss financial assistance options. Option 4. Suggest the mother take a nap while the infant is being monitored. The correct answer is C. Rationale. Correct answer, the third option. Offering to contact a social worker to discuss financial assistance options addresses the mother's immediate concern about the financial impact of her child's illness. This intervention directly targets her expressed anxiety about missing work and potential financial strain, which can help alleviate some of her stress. By addressing her financial worries, the nurse can help the mother focus more on her child's care and her own well-being. This approach demonstrates empathy and practical support, which are crucial in psychosocial care. Distractor rationales. A. The first option. While taking a walk might help clear her mind, it does not address the mother's specific concerns about finances and work. B. The second option. Providing information about support groups is beneficial, but it does not immediately address her financial worries. D. The fourth option. Suggesting a nap might help with her fatigue, but it does not tackle her anxiety about financial issues. Clinical tip: when supporting caregivers, prioritize interventions that directly address their expressed concerns to effectively reduce stress and improve their ability to care for their loved ones. A 16-year-old adolescent with a history of opioid use disorder is attending a health promotion session in a community clinic. The nurse discusses various strategies to support healthy growth and development. Which intervention should the nurse prioritize to promote positive lifestyle choices for this adolescent? Here are the options. Option 1. Encourage participation in a peer-led support group. Option 2. Emphasize the importance of academic excellence. Option 3. Advise on the benefits of a high-protein diet. Option 4. Recommend daily physical exercise of at least 60 minutes. The correct answer is A. Rationale. Correct answer, the first option. Encouraging participation in a peer-led support group is crucial for adolescents with opioid use disorder, as it provides a supportive environment where they can relate to others with similar experiences. Peer support can enhance self-efficacy and reduce feelings of isolation, promoting long-term recovery and positive lifestyle changes. Adolescents are significantly influenced by their peer group, making this intervention particularly effective. Such groups also offer opportunities for skill development and personal growth, addressing both emotional and social aspects of development. Distractor rationales. B. The second option. While academic excellence is important, it may not directly address the immediate needs related to opioid use disorder and its impact on psychosocial development. C. The third option. A high-protein diet is more relevant to physical health, rather than addressing the psychosocial components and lifestyle choices associated with opioid use disorder. D, the fourth option. Although regular physical exercise is beneficial, it does not specifically target the social and emotional support needed for recovery from opioid use disorder. Clinical tip: engaging adolescents with opioid use disorder in peer support groups can provide a sense of community and understanding that is crucial for maintaining long-term recovery and promoting healthy development. A 78-year-old resident in long-term care with a history of congestive heart failure, CHF, exhibits shortness of breath, crackles upon auscultation, and a weight gain of 3 pounds over the past 2 days. What is the nurse's priority intervention? Here are the options. Option 1. Administer oxygen as prescribed. Option 2. Restrict fluid intake. Option 3. Notify the healthcare provider. Option 4. Elevate the head of the bed. The correct answer is D. Rationale. Correct answer. The fourth option. Elevating the head of the bed will help improve the resident's respiratory status by promoting better lung expansion and reducing dyspnea, which is a priority in managing symptoms of fluid overload in CHF. Distractor rationales. A, the first option. While oxygen may be beneficial, improving respiratory mechanics with positioning is more immediate. B, the second option. Fluid restriction is important but not the immediate intervention. C, the third option. Notifying the healthcare provider is necessary, but ensuring immediate comfort and safety takes precedence. Clinical tip: for clients with CHF, monitor daily weights and assess for fluid retention regularly to prevent exacerbations. A nurse is educating a group of new parents about reducing the risk of sudden infant death syndrome, SIDS. Which of the following recommendations should the nurse include in the teaching? Here are the options. Option 1. Place the infant on their back to sleep. Option 2. Use a firm sleep surface with no soft bedding. Option 3. Allow the infant to sleep in the parent's bed for bonding. Option 4. Ensure the infant sleeps with a pacifier. Option 5. Avoid exposing the infant to tobacco smoke. Rationale. Correct answers: the first option, the second option, the fourth option, E. The first option, placing the infant on their back to sleep, reduces the risk of SIDS by maintaining an open airway. The second option, a firm sleep surface with no soft bedding, prevents suffocation hazards. The fourth option, using a pacifier during sleep, is associated with a reduced risk of SIDS. E. Avoiding tobacco smoke exposure is crucial as it is a known risk factor for SIDS. Distractor rationales. C. The third option, allowing the infant to sleep in the parent's bed, increases the risk of suffocation and SIDS. Clinical tip: educate parents on the ABCs of safe sleep: alone, on their back, in a crib. This simple mnemonic can help reduce the risk of SIDS.
That's it for today's question bank session, everyone. Your score and detailed rationales will follow in tutor mode. Discover Exam ASAP, our advanced AI-powered platform with over 5,000 peer-reviewed NCLEX-style questions. With adaptive testing, audio rationales, daily updates, and 24/7 tutor support, it's designed to help you pass the NCLEX on your first try. Visit yournursingspace.com for our ultimate NCLEX mastery notes and free study guides. Like, subscribe, and check out our website for more content. Keep up the great work, and we'll see you next time.